Thank you for joining us for this special edition of KPBS News. I'm Maya Trabulsi. San Diego saw a spike in COVID-19 cases this week as some restrictions were reimposed to slow the spread. On Tuesday, the county saw a record high 578 cases with a 10% positive test rate. Since March, San Diego has seen 18,000 cases with more than 400 deaths. The county is now on a state watch list, and that means dine-in restaurant service and movie theaters are among the indoor businesses back on hold for a 3-week period. The surge in local cases has been going on since mid-June. Contact tracing is a big part in efforts to flatten the curve. But KPBS investigative reporter Claire Tregeser found it has some big limitations.
Every day, Asma Al-Sabag goes to work and gives people bad news.
Hi, I'm calling from Mariella.
And I'd say, I'm calling because you were recently exposed to someone who tested positive for COVID-19.
Al-Sabag is one of nearly 500 contact tracers working for San Diego County. It's her job to find and notify people who were likely in contact with someone who's tested positive for the coronavirus.
They have to monitor their symptoms twice a day. They have to check for fever. We go through the whole list of symptoms. There's like fever, difficulty breathing, cough. There's a whole list that we go over with them and we send them out to them too. We encourage them not to do things like share utensils or share bedding, to wear face covers around each other.
Al-Sabag estimates she's made hundreds of phone calls, but all her hard work may not be having the desired effect. Cases have been surging in the county, with daily counts approaching 500 and the total tally over 15,000. Yet the county's contact tracers have only reached about 9,000 county residents who are identified as a close contact of someone with the virus.
The last time they were within 6 feet without a face covering for longer than 15 minutes.
Plus, the county does not know how many of the people contacted actually followed the public health order and went into quarantine.
It's turned out to be much more difficult to standardize across the state.
Andrea Lacroix is an epidemiologist at UC San Diego.
And to sew together from various institutions and make it happen.
She and other epidemiologists say a regime of widespread wearing of face coverings, social distancing, testing, and contact tracing is the only safe way to slow the spread of the disease until a vaccine is available.
So I'm going to go ahead and give you a follow-up call at the end of your quarantine period, so that'll be June 14.
Back at her desk, the contact tracer Al-Sabag is working the phones again.
We're going to go ahead and release you. Does that sound okay?
9 out of 10 times the person's like, yes, I already know who it is, it's so-and-so.
That's because the person with COVID-19 is a family member or close friend. But other times, she's greeted with real anger.
They refuse to even listen or complete the interview until you tell them who the person, who infected them or who they were exposed to was, and we can't do that.
This is just one of the limitations on a contact tracer's power. They're not reaching all the people they need to reach. They can't force the people they do reach to give them information, and they can't force those who've been exposed to stay home. Jeff Johnson, the head of the county's contact tracing program, acknowledges the limitations.
If they are threatening to go to work, then, we will have to talk with them and kind of advise them otherwise.
If a person does develop symptoms or test positive for COVID-19, the county then has the authority to force that person into quarantine. And if the person refuses,
we have somebody from the county, in some cases, has been a sheriff's officer, actually physically issue it. And like I said, that's been very, very rare.
Okay, do you have any loss of smell or taste?
As for Al-Sabag, she plans to continue going to work and helping people through the challenging phone calls they received.
Until contact tracing is no longer a thing, probably when a vaccine comes out, I'm guessing.
Claire Tregeser, KPBS News.
South Bay remains the hotspot for COVID-19 in San Diego County. Look for the Tracking COVID-19 section at kpbs.org and you'll find cases broken down by zip code. Otay Mesa, Chula Vista, and National City are at the top of the list. The situation is even more dire east of San Diego. Imperial County has been overwhelmed in recent weeks. Kyung La has a look at the challenge for healthcare workers.
When folks say, hey, it's a war zone, well, a war zone of what? A war zone of us trying to combat the COVID-19.
The front line in this battlefield.
Just craziness still.
Anybody else sick at home?
Southern California's El Centro Regional Medical Center.
This is intense.
Did you get the rest of her vital signs?
CEO Adolph Edward is a former Air Force officer and Iraq War vet.
I have seen this tent actually deploy with me when we were in Balad, when we were in Iraq.
Now he's built them on American soil.
Just put pressure right there.
To handle a crush of COVID cases his hospital no longer has room for. Air-conditioned tents in the triple-digit desert heat to handle patient after patient. El Centro is in Imperial County. It sits at the U.S.-Mexico border. This rural community is 85% Latino. 1 in 4 live in poverty. Per capita, it has 3 times as many COVID cases as Los Angeles, and the death rate is the highest in California.
Is it crazy to you that you are a physician working in a tent in America?
Yeah, it's incredible, isn't it? Yeah, we'll make it through.
Inside the hospital,
It is exhausting.
we visit the sickest patients in the ICU.
She's a new patient.
Yeah, so she'll be a new patient. She's a transfer from the regular floor.
Every single patient in this 12-bed ICU has COVID. 11 of them survive with ventilators.
Can you explain what you're wearing?
Well, it's a device that helps keep everything, kind of like closed so we're not exposed to anything.
It's what nurse Amber Mares needs to wear to stay safe while helping her 40-year-old patient.
How sick is he?
He's really sick and he's really young, so we're trying to do everything we can before we intubate him.
What is that suggesting to you as a nurse, that the age is dropping?
I think that a lot of people aren't honoring the stay at home. A lot of people aren't doing the social distancing.
That's what the El Centro Fire Department sees on the street.
El Centro Fire Battalion.
The battalion chief says in this town of 50,000 people, every single hour it is this.
There's a possible COVID patient on scene. So at this point, our personnel are gearing up for a COVID patient.
In a full hazmat suit, Captain Chad Whitlock revives an unconscious patient. It's a stifling 110 degrees.
We have to decon all the equipment and remove all our uniforms and take a shower and put a different uniform on for the rest of the day.
You're dripping.
Yes, ma'am. We're inundated. Everybody's really tired and you can see it in my face, we're frustrated.
That patient Captain Whitlock saved arrives at El Centro Medical's emergency room.
We've hit capacity. We've transferred out 2 or 3 times the normal amount of patients that we're sending out. I think in the last 2 months we sent out something like 500 patients.
Some to nearby San Diego, others as far away as Northern California. This helicopter is here to pick up another patient.
Get started in there because they're here for him.
ER doctors and nurses intubate under this blue drape to limit particle exposure. Stabilized, the patient heads out.
Why is it happening so badly here in Imperial County?
There are a lot of U.S. nationals that live in Mexicali. They had a really bad outbreak there. There's a lot of people that cross the border here for work that live in Mexicali and then come and work here.
The fields in Imperial County send produce across the country. And even in a pandemic, some 20,000 Mexican day workers enter legally every morning to provide the labor. No work, no money for food, says 65-year-old farm worker Jacinto Moreno. 4 of his fellow farm workers have died of COVID, he says.
We cannot win a war on COVID in the emergency room. Look at the big picture. We need to fight the war on COVID where it's breeding, and that's our neighborhoods.
In this bi-national county, COVID is not the disease, it's the symptom.
They experience social determinants of health, like putting food on the table, like having to work in dangerous conditions, like not having a mask. We are the poster of those inequities and the reason why we're not able to control COVID.
The hospital here is bracing for what's yet to come. This empty tent is the future COVID ward.
Is this tent a sign that this pandemic is here to stay?
Yes, so I keep telling folks, look, now it's a pandemic, eventually it's going to be an endemic, so is this really how we want to take care of our communities? And the answer is no.
And that was Kyung La reporting. KPBS has more on the situation in Imperial County, including a recent interview with the director of the Public Health Department. Click on the Tracking COVID-19 link at kpbs.org. The USS Roosevelt is back in San Diego. KPBS military reporter Steve Walsh says the carrier waged the Navy's most high-profile battle with COVID-19.
When the Roosevelt left in January, the highlight of the deployment was supposed to be a rare visit to Vietnam. Instead, in March, an outbreak of COVID-19 crippled the carrier, which was sidelined in Guam. More than 1,500 of the nearly 6,000 crew members would test positive. Captain Carlos Sardiello says the remaining crew is symptom-free.
As far as lessons learned, I would offer that what is being done in society with the masks, the social distancing, and the cleaning, those measures absolutely work.
Sardiello replaced Captain Brett Crozier, who was fired by the acting Secretary of the Navy after a letter Crozier wrote critical of the Navy's response was leaked to the media. Chief of Naval Operations Admiral Michael Gilday initially backed Crozier's reinstatement, then reversed himself and sanctioned Crozier and the admiral in charge of the task force after a report came out which was critical of their response. Neither man was at the podium for the ship's return. Sailor Daniel Wright praised his former captain.
I am grateful for everything that he did for the crew and for the ship, and for getting us the assistance that we needed when it was discovered that the coronavirus was out of our hands and required further assistance.
The current captain would not comment on the report, saying the two captains remain friends. In an unusual homecoming, families waited in cars off the dock to remain socially distant. Steve Walsh, KPBS News.
On Friday, Governor Gavin Newsom announced he wants to release thousands of people due to the COVID-19 spike inside state prisons. Hundreds have already been transferred to immigrant detention centers, which may be accelerating the spread. Max Rivlin-Nadler tells us some lawmakers want to put a stop to it.
Advocates and lawmakers are now focused on a major contributor to the continued spread of the virus inside immigration detention. People who have finished their prison term and are transferred to ICE custody for possible deportation. Over 250 people have been transferred from California prisons to ICE detention since Governor Newsom issued a stay-at-home order. Among them were 3 people who had already tested positive for COVID-19 in early June while in prison in Riverside County. Their transfers were allowed to go ahead anyway. Bay Area Assemblymember Rob Bonta was one of 50 state legislators, including San Diego's Ben Wesso, who sent a letter to Governor Gavin Newsom asking him to issue an executive order stopping these transfers.
This is what meeting the moment looks like. This is a governor who has met the moment time and time again. I'm confident and hopeful that he'll meet it again with us on this issue and be our partner and work with us to make sure we're doing right by our Californians in custody who do not need to be sent to potential death sentences in immigration detention centers.
Last week, a Cambodian refugee was released from San Quentin prison directly to his family. Advocates say it's safer for immigrants facing deportation who have already served prison sentences to continue their immigration case from home, and not in immigration detention, where coronavirus has run rampant. Charles Joseph was sent to the Mesa Verde Detention Center after being released from prison. A judge ordered his release this April as COVID-19 began to spread in the detention center.
Why are people being in prison, in detention, for indeterminate sentences over a civil matter, even though they have families, communities, homes, and the ability to appear for court appointments?
The Otay Mesa Detention Center has had 167 positive cases of coronavirus since March. ICE did not respond to a request for comment about how many people have been transferred from state prison to the facility. Max Rivlin-Nadler, KPBS News.
Tuesday was the first day of closures for indoor operations at restaurants, tasting rooms, and other businesses. KPBS reporter Matt Hoffman says the move is affecting some places and their staff more than others.
Restaurants can still serve customers, but it has to be outside, so like using a patio or a parking lot, but some eateries don't have either.
You try to make your hay while the sun's shining. Well, the sun is definitely shining, but I'm not allowed to make any hay right now.
Guava Beach Bar and Grill owner Eric Christensen says he was making it work with recent restrictions requiring food with alcohol purchases and closing early at 10 p.m. Going back to just takeout, though, won't be easy.
Takeout's pretty tough. You know, I was down maybe 25-30% with the dine-in, which is doable. Takeout, I'll probably be down over 80%. So at some point, if we aren't allowed to put tables out front, we're going to have to weigh our options. Is it even worth it to do it?
San Diego officials are waiving permitting fees and fast-tracking applications for outdoor service. But along a busy Mission Boulevard with limited space, Christensen thinks his only option is to try and use the sidewalk out front.
Hopefully by next week we'll be able to have at least maybe 5 or 6 tables out front. As it stands today, we've got nothing going on, just doing takeout.
So no dine-in service for 3 weeks, and places like Guava Beach Bar and Grill are again having to make the tough decision to lay off staff.
My staff's down at least, cut by 50% now, and so then you got to figure out who wants to work, who's going to go back on unemployment, with that $650 incentive in there per week.
In March, April, May, when bars and restaurants received the initial order to close down to in-person dining, we received layoff notices for restaurants that mapped to almost 18,000 workers that had been impacted and lost their jobs, specifically in the restaurant and bar industry.
The San Diego Workforce Partnership says they're expecting to see layoffs again during this 3-week shutdown. Some argue that blanket closures for industries punishes those following the rules.
Is it fair? It is what it is. It's not for me to judge. It's definitely a disappointment, as July is our busiest month of the year.
For restaurants in tourist hotspots, summer months can make or break their business.
Given our location here in Mission Beach, we're inundated with vacation rentals. So I'm much more seasonal than, say, a place that's downtown or in North Park or anything like that. So if I can't make my money over the 4 or 5 months over the summer with all the tourists out here, it's a lot harder in the off season, and we'll see.
Talk of COVID-19 restrictions hits close to home for Christensen.
Being that I just got off of quarantine for having COVID, I understand the severity of it out there.
He's virus-free after quarantining at home, but now he's worried about his wife and daughter.
It's real, it's contagious, and it can affect anybody.
Christensen put in his application to use sidewalk space for dining and is waiting to hear back from the city. Matt Hoffman, KPBS News.
People of color, especially Black communities, are being hit the hardest by the coronavirus. KPBS science and technology reporter Shalina Chatlani says chronic stress from racial discrimination could contribute to poor health outcomes.
In her City Heights apartment on a recent Monday, Fatima Ahmed drops a traditional Somalian donut into a pot of boiling oil.
Mandasi is in bread, in flour, yeast, and sugar, a little bit sugar, not too much. And with the eggs, to mix it,
Ahmed cooks a lot now to de-stress. She moved to the United States as a single mother over a decade ago to escape civil war in Somalia, where her husband was killed. She feels safer here, but recently the COVID-19 pandemic and protests against police brutality have made her anxious. Her niece, Faiza Warsame, translates.
Would they get the COVID-19? Are they gonna, face any problems with the police? There's so much worry that's going into my head when they don't answer my call and they're not giving me a call back.
Ahmed says she doesn't know any therapist who speaks Somali. She talks to friends and family to feel better, but she still often feels anxious and says she sometimes takes painkillers before sleeping.
When I'm stressing so much about my children, I don't get sleep. So with no sleep, the body hurts. So not having enough sleep and not being able to sleep, my whole body just aches and hurts.
National data show Black and brown communities are being hit the hardest by the pandemic. And many public health officials, including San Diego's public health officer, Wilma Wooten, says that's due to underlying health conditions like obesity, hypertension, and stress. But some academics argue that racism is a chronic form of stress that can't be treated medically. April Timms is a University of Southern California neuropsychologist.
Those kind of stressors can affect anybody, but we tend to see them disproportionately in ethnic, racial, minority communities. But then there's another type of stressor which is different, which is stress that's directly tied to your race.
Tim says chronic stress for people of color is tied to uncertainty. Will I be stopped by a police officer today? Will I be judged? Or will I be harassed? Timms and her colleagues looked into the science of how this anticipatory anxiety biologically affects the body.
And we saw that Blacks, more so than whites, had this pattern of sort of, if you will, susceptible gene expressions.
There are certain genes or parts of our DNA that regulate how we handle pathogens like the coronavirus. In her research, Timms found Blacks expressed more genes that caused an inflammatory or swelling response and fewer genes that produced an antiviral response, which helps the body fight a disease. Timms says all the people who were studied had similar socioeconomic backgrounds and access to health care.
The only potential stressor that differed between the two racial groups was discrimination experiences.
The research suggests stress from chronic racial discrimination not only causes issues like high blood pressure, she says it also biologically makes it more difficult for people to fight off diseases. So it's not only Black mothers that are worried. A number of young Black men from City Heights launched a community mental health support group about 3 years ago. They get together in the corner room of a nonprofit group, United Women of East Africa. They play games, shoot hoops at a nearby basketball court, but mostly they talk. Abdirazak Ahmed is one of the organizers.
So how has everything been for you guys? I know we haven't met in a long time.
But not everyone in these communities have this type of outlet. One participant, Abdi Hussein, says there's a stigma within the community of admitting you need help.
It kind of gets brushed under the rug a little bit because as Black people, we kind of have this aura of getting over it, and especially as teenagers and young adults and stuff like that. We're already dealing with life-changing things, and then on top of that, you add racism.
Hussein says the younger Black generation is increasingly realizing how critical mental health is, but he feels that people outside the community are still not seeing it, even those who work in the medical field.
From a professional standpoint, the institutions that exist have to have cultural competency when these professionals are coming along to realize, okay, you can't talk to this person like a regular American, or you can't talk to this person like the community that you're used to all the time. You have to tailor to them, and you have to see what are the ins and outs of it. Hire, like you said, there's plenty of people that are psychologists that are Somali that can fill these jobs. Hire them.
As communities of color continue to be hit the hardest by the pandemic, scientists say racism is a key medical issue that has to be factored into the public health response. Shalina Chatlani, KPBS News.
A new Trump administration policy would force international college students out of the country if they don't attend in-person classes this fall. KPBS education reporter Joe Hong has reaction from local universities.
UC San Diego has more than 5,600 international students whose futures could be threatened by a sudden change in policy from Immigration and Customs Enforcement, or ICE. It requires international students to take at least one in-person or hybrid class in the fall. Students who can't comply with the new rule will be forced to transfer to another college or leave the United States.
So the announcement on Monday came as a surprise, I think, to many of us in higher education.
Dulce Dorado is the director of the International Students and Programs Office at UC San Diego.
Our quarter doesn't begin until late September, so there's still some time in terms of the university really trying to assess what enrollment looks like, and then, what course offerings may need to be adjusted, or what additional course offerings will need to be made.
Both UC San Diego and San Diego State University issued statements on Tuesday that criticized the new rule for creating confusion for students amid the global pandemic. SDSU officials advised students not to make any sudden decisions or changes to their academic schedules and to not make plans to leave the country. UC San Diego's Dorado encouraged students who need help to reach out to their academic advisors.
I want to say is that they're welcome here, and we want to make sure that we're here to support them in every way that we can.
Joe Hong, KPBS News.
The Del Mar horse racing season is underway, but you won't find big crowds, fancy hats, or mint juleps. Cara Finstrom has the story.
Split it and we're just gonna do it. These best friends live an hour-and-a-half drive from Anaheim, so they rented a room and broke out matching ears and masks for downtown Disney's reopening.
Obviously we want to like go into the parks, but we know it's not safe yet. And so we'd rather just, be here and be able to do a little bit of shopping.
It's just some Disney magic because during this whole pandemic, everyone's been very stressed and at home, and it's just nice to kind of be out and having fun.
A line of cars stretched well down around the block hours before downtown Disney even opened up. But parking and guest capacity will be limited as part of new safety protocols. About 25 stores and outdoor dining areas are welcoming back guests with plexiglass partitions, contactless payment options, and socially distanced lines and seating areas. Temperatures will be taken with mask requirements for visitors ages 2 and up. And unlike Florida's Disney World, which will reopen some parks Saturday, Disneyland and
I can hear you. I can hear you. I can hear you. My mic's good. My teleprompter went down.